Ear pain during flights is something almost every passenger has experienced at least once. Whether it's a dull pressure, a sudden pop, or a sharp stabbing sensation, it tends to happen during takeoff or landing, and for many, it's one of the most uncomfortable parts of flying. But why does this happen? What exactly is going on inside our heads when the plane climbs to 35,000 feet? And why do some people suffer much more than others? The answer lies in basic physics, specifically air pressure. At sea level, the atmospheric pressure is about 10-13 hectopascals. But as we go higher, the air becomes thinner and the pressure drops dramatically. At cruising altitude, usually around 10 to 12 kilometers, or roughly 35,000 feet, the outside air pressure is only about 1/4 of what it is on the ground. To keep passengers comfortable and alive, modern aircraft are equipped with pressurized cabins, which maintain an internal pressure equivalent to being at about 2,400 meters, or 8,000 feet. But even with this controlled environment, the pressure still changes, and not everyone's body can adjust instantly. That's where the trouble starts. Inside your head, you have a small but essential structure called the eustachian tube. It connects your middle ear to the back of your nose and throat, and its job is to equalize the pressure on both sides of your eardrum. Under normal conditions, it opens automatically when you swallow, yawn, or chew, allowing air to flow in or out of the middle ear. But during rapid changes in altitude, like when a plane takes off or descends for landing, the pressure around you shifts faster than your body can keep up. If the eustachian tube doesn't open properly, a pressure imbalance forms, causing your eardrum to bulge inward or outward. That's what creates the feeling of pressure, blockage, or even pain. This sensation is medically known as ear barotrauma, and in severe cases it can even lead to ruptured eardrums or fluid buildup. Children are especially vulnerable because their eustachian tubes are smaller, more horizontal, and more easily blocked, which is why babies often cry during flights, especially when the plane is descending. So, what can you do to avoid or reduce this ear pain while flying? The simplest and most effective method is swallowing. Every time you swallow, your eustachian tube opens for a brief moment, helping to equalize the pressure. That's why chewing gum, sucking on candy, or drinking water is so helpful during takeoff and landing. For infants, breastfeeding or using a bottle serves the same purpose. Another technique is the Valsalva maneuver, where you pinch your nose, close your mouth, and gently blow as if you're trying to pop your ears. This forces air into the eustachian tubes and can often relieve the pressure. However, this should be done carefully, especially if you have a cold or sinus congestion, as forcing too hard could do more harm than good. Speaking of congestion, if you're sick, your eustachian tubes might be swollen or blocked, making it much harder for your ears to adjust. In these cases, doctors often recommend using nasal decongestants before a flight to reduce inflammation and help with pressure equalization. Some people also benefit from antihistamines if allergies are a factor, but again, only after consulting with a physician. For frequent flyers, or those especially sensitive to pressure changes, there are also special pressure-regulating earplugs designed for air travel. These earplugs have a small filter that slows down the rate at which air enters the ear canal, giving your eustachian tubes more time to adjust and reducing the discomfort. It's important to know that in almost all cases, ear pain during flying is temporary and harmless. But if it persists after the flight or worsens, you should see a doctor to rule out an ear infection or more serious blockage. So next time you board a plane, remember that annoying ear pressure isn't dangerous. It's just your body reacting to an unnatural environment. Planes take us to places our ancestors could only dream of, but our biology is still catching up. And if you love learning how the world works, whether it's the physics of flight, the mysteries of the human body, or the science behind everyday life, subscribe to Almost Fiction. We explain real phenomena with real facts in a way anyone can understand. No myths, no exaggerations, just curiosity and clarity. Thanks for flying with us today. Don't forget your water bottle, your chewing gum, and your curiosity. See you in the next video.